May 5th, 2021. It was late afternoon, fairly nice day, and I thought I would go for a bike ride. Towards the end of the bike ride, I started to feel some pain in my back between my shoulder blades. I got home and the pain started to get a little bit worse, and I had thought this can't possibly be a heart attack. I was 53 at the time. I had no prior symptoms of any kind, really. Walked around the house, and within about a minute, it exploded into my chest. I knew at that point something bad was happening. I really didn't think I was going to survive. I really had a moment where I said, I don't know if I'll make it. You're terrified and you're trying to survive all at the same time. I remember thinking to myself, don't die. I got to the hospital, and I remember thinking in my head, I beat you. I got here, because I really couldn't believe I made it. In 15 minutes, the procedure was done. I mean, amazing. My wife got to the hospital. I remember saying to her, what just happened? I had a blockage that was on the side of my artery that ruptured off the artery and then blocked my artery 100%. Doctors don't like the term, but I've heard the term widowmaker heart attack. The worst thing that ever happened to me became the best thing that ever happened to me in really changing my life. Dr. Arkanak came in with Dr. Patel the next day. I said to them, thank you for saving my life. And one of them said, you did the hard part. And I said, what's that? And I think Dr. Arkanak said, you made it to the hospital. Most people who have a heart attack like you had, they wait and then they don't make it to the hospital and then they pass away. It's humbling sometimes to think how many people don't survive. I actually have a tattoo on my arm of an EKG with the 12%, which is the survival rate of somebody who had a heart attack that I had outside of a hospital setting. Dr. Patel came in before I was released, and he said, I want to recommend you for the Orange program. I had no idea what it was. It sounded great. It turned out to be great. Food took on kind of a new role for the first time in my life. Today, I would say I am different in the sense that I view food, exercise, stress differently. I don't look at them so much as things that happen to me as things that I can control. And that's something I learned in the program, of course. There were some group therapy aspect to it as well. That is something that was important even after the program, because the other members of my cohort, we stayed in touch. Just connecting in that way with people that understood was really important. And that was an aspect of the program that I did not expect to enjoy so much. Dr. Patel is the first doctor that I've ever had in my life that I felt like was thinking about me when I wasn't in front of him. He took a real active approach into helping me, face what I was going through. And he and I have developed a real nice relationship where we'll text each other. He'll check in, how you feeling? How's your medication going? I feel like somebody's got my back. One of the silver linings to my experience for me has been that I've been able to share what happened to me with friends of mine who are my age group. So many of them literally took it to heart and went to a cardiologist or went and got checked up. I am fortunate that I survived, and I am fortunate that I was able to get into the Orange program and learn and now have a second chance. A lot of people don't get that.